today. My name is Crystal Joy.
And my name is April Dinandao. Today, we're going to be conducting ear and hearing examination.
Good morning, Miss April. My name is Crystal Joy, and I'm going to be your nurse for today. But before that, can you please tell me your full name and date of birth?
My name is April Andao, April Generation Andao, and I was born on March 10, 2003.
So for today, we're going to have ear and hearing examination. And the purpose of ear and hearing examination is for us to evaluate the external condition of your ears and also the condition and patency of your ear canals, as well as the status of the tympanic membrane in your ears, and also the bone and air conduction of sound vibrations in your ear, your hearing acuity, as well as the equilibrium of your ears. So is that okay with you?
Yes, ma'am.
Okay, so now I would like to ask you questions that is related to your ear and hearing history. So is that okay with you?
It is okay.
Okay, so let's begin with your personal health history. Have you ever had any problem with your ears, such as infections, trauma, and earaches before?
Actually, I never had any common ears. Even since I was teenager and a kid.
Okay, that's good to know. How about any past treatment that you have received for your ear problems before?
No. Since I don't have any problem with my ears, I never had any. Sorry.
Is there any history of hearing loss in your family?
No, there's no history of hearing loss in the family. However, I noticed that as people grow older, their hearing actually lessens or get, meaning.
So let's move to the lifestyle and health problems. Do you work or live in an area with frequent or continuous loud sound or noise?
Wala naman, kasi nakatira ako sa bukid. Ang narinig ko lang doon yung mga hayop, narinig ko yung mga kaibigan.
You spend a lot of time with swimming in water? How do you protect your ears when you sleep?
No, I don't sleep. I don't like sleep.
If your hearing affects your ability to care for yourself,
No.
so when was your last hearing examination?
Last year,
Do you wear a hearing aid?
no, I don't.
How do you care for your ears?
Twice a week, nililis ko yung ear ko using cotton buds. Yung kapag nalilig ako, binamit ko na
So we're done with the questions. Now we will move on to the procedure.
Good morning, ma'am. How are you?
I'm doing good. Thank you.
My name is April Andao, and I will be your nurse for today's specific time. And before anything else, I would like to ask you, what's your name and your birthday?
My name is Lisa Bailey, and my birthday is November.
Okay, thank you. So, what I will be doing is that I will be assessing your ear and hearing ability. So, I will be doing that is for us to, for me to determine if you are dealing with some problems with your ear and hearing ability, and determine if there is any problem or infection, trauma, or earache?
No.
Okay, that's good. So, if you didn't have anything, any problem with your ears, have you ever tried going to some clinics or treatments?
I never had it here before.
So it's essential.
It's my first time.
You know, there's a family history. So, is there a history of hearing loss in your family?
I think I never seen anyone having hearing loss. Yeah.
That is good. That's good. I'm happy to hear that. Memorize lifestyle and health practices. Pagdating daw po kayo sa area na maingay ang kapaligiran. And kung doon naman kayo nakatira or nagagap ko, how do you feel like you're living in the life of your places?
The surroundings of our house is serene because we are living in a field. Maybe we're just encountering sometimes some loud vehicles, but usually it's quiet in our place.
So, those sometimes things isn't a problem. Is it?
No, sometimes we hear when there's occasion we hear loud video office. But it's just occasional.
You spend a lot of time swimming, and if so, how do you prepare yourself from the water when you're swimming?
I usually don't immerse my head when I do swim. I just immerse only the lower part of my body.
Ako rin, sa totoo lang, I don't swim. I don't swim a lot. So, has your hearing affected your ability to care for yourself or to work?
No.
Has your hearing loss affected your socializing with other people? No, since you don't experience hearing loss. When was your last hearing examination?
I never had a hearing examination yet. This is my first hearing examination test. So this is the last. I hope this is not the last.
Maybe. Let's hope for the best. Do you wear any hearing aid? How do you care for your ears? And if you care for your ears, can you describe how you do it?
I just wet my ear with the cotton buds once a week, and then when I'm taking that, I'm wiping the external part of my ear with a towel. So that's it.
And it's great. Okay. Now, ma'am, I'm going to check your oracle, lobule, and tragus. Is that okay with you?
Yes.
Okay. Can you sit erect? So as I can see, it is the normal. I decided it's normal. The skin has no lumps, and it's smooth. And kaparehas lang din ang color ng yung ang ears yung facial color nyo. So that is normal. There is no abnormalities actually. And let's see, there is no discharge as well. So overall, inspecting your ears, everything is normal.
Next, we're going to palpate the auricle of your ears, your tragus, as well as your mastoid process. In this assessment, we're going to assess the texture as well as the elasticity and the tenderness in the areas of your ears. So is that okay with you? So as I palpate those areas, you need to tell me if you feel any tenderness in any of those areas. Is that okay with you?
It is very much so.
Okay. So I will start. We move closer and very closer. I will start with your stratus. So here, do you feel any tenderness?
No.
How about here?
No as well.
How about here?
No.
Here.
No.
How about here?
No.
Here.
No.
Okay. So, as I can see, as I palpated your tragus, the auricles of your ears, as well as the mastoid process, I haven't seen any tenderness, which means you don't have any symptoms of otitis externa. You don't have any occurrence of otitis media, as well as the post-auricular cyst. Okay, so next.
So for our first examination, I will be conducting a whisper test, which is actually done for me to detect if you're experiencing conductive or sensory neural hearing loss. Um, can you please start, ma'am? Okay, so follow what I say. You have to hold your ear like this, see, and then massage your tragus in a circular motion. Um, okay, but first one that you will be massaging in a circular motion is your left one, and then the other one is the right. Okay. So, ulitin niyo po yung in-whisper ko. And then, if hindi niyo po maririnig or if magkakamali kayo, ay uulitin ko muna sabihin yung whisper ko. For example, I will whisper something like apple. You will say, you will repeat after me, okay? Is that good? You understand? You have any question?
No.
Let's begin. So I will be at the back, 2 feet away from you, so you won't be able to see my expressions or how I pronounce words. So let's begin.
Story.
Great. Great. So as I can see here, right, there is normal. However, now I'm going to test your left ear.
Wisdom.
Good. Now I can tell that you're not experiencing any conductive or sensory neural hearing loss.
Okay, so now we're going to perform the Weber's test. So in this test, we're going to identify whether you are experiencing conductive hearing loss or sensory neural hearing loss. So is that okay with you? So yes, okay. So now what I'm going to do is I'm going to have this tuning fork, and then I'm going to place it at the center of your head, and you have to tell me whether you're hearing the sound on both of your ears or only in one ear. So you have to be observant of where you hear the sound. So let's begin. So where did you hear the sound? Which ear do you hear the sound better?
I think pareho lang naman. I think both can hear the sound.
since you're able to hear the sound equally in both of your ears, that means that the vibration of sound is equally heard in both of your ears. And there's no lateralization of sound in either of your ears. And that indicates normal hearing function. Okay, so now we will move on to our next test. This is called Rinne test. So in this test, we're going to compare the air and bone conduction of sound in your ears. So is that okay with you?
Yes, it is.
So in this test, I'm going to strike this tuning fork and place it in your mastered process, and then you're going to tell me if you no longer hear the sound. Say stop if you don't no longer hear the sound, so that I can move the tuning fork in front of your ears. Once I move it in front of your ears, you have to tell me if you can still hear the sound. Say yes if you can still hear. Say no if you can no longer hear. So you have to give me two answers. Tell me stop once you no longer hear the sound, and then tell me yes if you can still hear the sounds once I move it in front of your ears. So is that okay with you?
It's okay. Stop. Yes. Stop. Yes.
So because you're able to hear the sound after I move the tuning fork in front of your ears, that means that air conduction is longer than the bone conduction of sound in your ears. And that indicates normal hearing function of your ears. So I will take note of that.
Now for our second examination, I will be conducting a longer test. So it determines the equilibrium of the patient. Okay. So can you please stand up? Let me see. And so what you have to do is to put your hands on the side. Your hands on the side. Nice. Your fists should be close with each other. Open your eyes. Now we'll be here. Now I tell you to close your eyes. Close your eyes, okay? Close your eyes. So hindi lang ako pagkakulong. Kailangan is starting with speaking normally. Relaxing. That's 20 minutes. You can open your eyes now. So, as I can see, you are very much normal. You have normal equilibrium, and that indicates that you're not having a vestibular disturbance.